And now to that where we begin. And over the next hours, you're going to be exposed to unbelievable truths about glaucoma. Are you ready to give the first presentation? Come on up. And so we begin.
Thank you. Hi, everyone. Thank you for having me here. My name is Aminlari. I'm one of the glaucoma fellows here at Wills Eye Hospital. It's a pleasure to be here. I was asked to speak today on what exactly is glaucoma. So to understand what glaucoma is, I think a good way to understand it is to understand what the eye actually does. And the good way to do that is to compare it to maybe a camera, one of those old school cameras. And the same way that in a camera, what you're trying to do is you're taking this imagery, texture, color in your universe, and you're trying to put it together and make one picture. Well, the eye does the same thing. And if you break down the components of the camera, it's very similar to what the eye does, okay? And the front part of our eye is very similar to the front part of a camera, which is the lens. The front part of our eye is called the cornea. That's the clear portion of the eye itself. And that really it helps us to prevent a barrier from the outside world, but it also helps us to be able to focus light a little bit more and focus these light rays and this imagery more so into the back portion of the eye. And as we move further into the back portion of the eye, we see the color part of your eye, which is called the iris. And that's the circular portion there, and that's very similar to the focusing ring on a camera. And the lens itself that sits behind the iris helps to focus light even more onto the back portion of the eye, which is called the retina. And the retina is very similar to the film inside of a camera. And when you take this picture from the outside world, it gets snapped onto the film, and it needs to go get processed for you to be able to see exactly what the picture is. Well, the processing center for us and our humans in the body is in your brain, and specifically it's in the back part of your brain. So what happens is you have this picture that you take, right, that you see that's in the eye, but you need to process it in the back part of your brain. And so you need some sort of connection there. And what happens is all of these little pictures that happen in your whole visual field, they get snapped, and they come together at one area in the back part of the eye called the optic nerve. And the optic nerve is composed of over 1 million nerve fibers, which are little specks of your picture. And they come together and they form this optic nerve, and the optic nerve is actually the cord that connects the eye to the brain to give you an idea of what you're exactly seeing. So you can imagine that this optic nerve is very vital to being able to see what you're seeing. And it's important because it comes into play in glaucoma, and we'll talk about that in a little bit. So now you know a little bit how the eye works. It's very much like a camera. But now I want you to kind of think about what the function of the eye is. How does the eye keep its shape? What's the purpose of the eye to keep its shape? And the best way for me to explain that is if you imagine a sink and a faucet, right? The eye keeps its shape by creating a fluid inside the eye called aqueous humor. And this aqueous humor is intended to keep the eye in a certain shape, and to keep the front portion in a certain shape and the back portion in a certain shape. And if you think about it as a sink with the faucet always on, there's a drain that always continues to run as well. And the eye, that's a very similar analogy there. What happens is we have this muscle back here that sits behind the iris that we call the ciliary body, and it creates a fluid. And this fluid, it helps to nourish some of the vital structures in the eye, such as the lens that sits behind the iris. And as it comes forward, it creates the shape of the eye, and the front portion of the eye. But it needs to get drained from the eye as well, okay? As a simple drain in a sink. And how that happens is the front portion of the eye that we were talking about, the cornea, meets the iris, the color portion of the eye. And where that meets is at an angle. And at that angle, we see this structure here, and it's a sponge-like structure that we call the trabecular meshwork, and that's your functional drain inside the eye. And the pressure that's created inside the eye, the intraocular pressure, is very important, and you may have heard of it. That's from what we talk about when we talk about glaucoma a lot of the time. It's to create this equilibrium inside the eye, where fluid is made, it creates this pressure inside the eye, and it creates this shape, but it needs to get drained, because any more fluid that's built that's not drained out, it's going to stretch the eye. Okay. So that, I just want you to understand what's going on there. So then now you know the function, you know the structure, and you know a little bit about what the eye does. So what is glaucoma? Glaucoma is a group of different eye diseases that present with a characteristic damage to your optic nerve, that structure in the back of the eye that's composed of all these little pictures, all these nerve fibers in the back of the eye. And when the optic nerve is damaged, what happens is that you get these visual field changes. And your visual field is what you're looking at, and you're looking at me, and what everything is in your visual field at this moment. And in glaucoma, we have specific damages to your visual field that we can see, and eventually you can lead to some blindness. So in glaucoma, what we know is, in most cases, that this is a slow, progressive, and chronic disease that is there for your life, and that you need to know about. Most cases, I say this now, we'll come back to it later, but in most cases it's very slow, but it's progressive, and that's what you need to know. And what are the causes of glaucoma? Well, they've done a lot of studies to see what exactly is the cause of glaucoma. And one of the things that I want you to be aware of that I didn't say in my definition is I never really talked about intraocular pressure. And intraocular pressure, they have found, is actually a risk factor for glaucoma, but it's not the end-all, be-all of glaucoma. So that intraocular pressure has a component to our glaucoma, but it doesn't necessarily have to be there, an elevated pressure for there to be glaucoma. And I want you to remember that as we go along. Okay, so then you're telling me that elevated pressure inside the eye is a risk factor for glaucoma, but how does that really occur? Okay, so let's go back to our analogy of the sink. And the faucet's always on, and the drain is always running, and there's an equilibrium there, right? So it's constantly going into the eye and outside of the eye. Well, what about if that drainage doesn't work as well? And that's what happens in glaucoma. Your drainage doesn't work as well, and so pressure can start to rise. And if you think about the faucet, what happens is, you'll just have overflow of fluid, and it'll flow outside of the faucet, and it'll fall into the floor, and you just clean it up, and that's fine. But the eye is a closed structure, right? So when you're making more fluid than you're actually draining, it's not going to go anywhere but inside the eye. And so pressure gets built up inside of the eye. And where does it go? It starts to push back. And one of the areas that it starts to push back on and creates tension on is the back portion, which is that vital structure that we were talking about earlier, called the optic nerve. And over time, in a slow progression, that optic nerve starts to get damaged. And that optic nerve is susceptible to damage in certain areas that we can see in glaucoma. And that comes into play when we start to talk about symptoms of glaucoma and what exactly it is that we see on your visual fields that you may take in the office. And that is different than another optic nerve damage from another cause, okay? So then, what are the symptoms of glaucoma? The unfortunate part about most forms of glaucoma, and I say most forms because it's not everything, but most forms of glaucoma, there are no symptoms. And the reason for this is this. As the pressure rises, it's usually in a slow way. And when it's in a slow way, that means that the eye begins to adapt to this elevated pressure. The eye begins to adapt to this elevated pressure and so you don't get symptoms like pain or anything. But the optic nerve starts to get damaged slowly. And you start to lose what we call your peripheral vision. And your peripheral vision is what you see outside of the central part. What you concentrate on is central. When you're looking at me and this presentation behind me, what you're focused singularly on is just me, and it's in the central part. But in glaucoma, what we lose is our peripheral vision. And that peripheral vision, you don't really pay attention to. As you're looking at me right now, you're not paying attention to the person next to you, right? You're just focused on me. And so in glaucoma, that's unfortunately what we lose is the peripheral vision. And over time, as that pressure starts to rise even more and the optic nerve starts to get damaged even more, that peripheral vision starts to encroach more centrally. Until the point where you get a little bit more advanced, right? And that peripheral vision starts to encroach more and more centrally, that where you finally suddenly see yourself looking through almost a tunnel. And that's what glaucoma is. It's a slowly progressive disease that you begin to lose your peripheral vision until it starts to encroach centrally. And eventually, in some patients, unfortunately, even though we have great treatments and we have great physicians that can be able to pick this up early, some people do progress. We typically see this in third world countries that people don't know about this because they don't have as good of a care as what we do in this country with good diagnostic capabilities. We don't see that. So a lot of these people that progress, they come in very late in their disease progress and they have just a little bit of central vision left. And that's what we try to save. But some of these patients do go blind and they do lose their central vision. So a common question that we see in our clinics is, I was told that I have increased pressure. Does that mean I have glaucoma? And the answer is not always, okay? And the reason I say that is because my optic nerve is different than your optic nerve is different than your optic nerve. And my optic nerve may be able to withstand elevated pressures inside the eye different from maybe your optic nerve or your optic nerve. And so I would be able to say, well, my pressure that is considered above a normal, and normal we say is within a population. We take a look at all the normals in a population. We say between 95% of people fall into these two numbers, and that's what we consider normal. Well, if I'm one of the 2.5% that falls above that number, then that means that my nerve can withstand that. And so it doesn't necessarily mean, that's why we don't use intraocular pressure as part of our definition of glaucoma, but eventually, remember that I said that intraocular pressure is still a risk factor. So that doesn't mean that you won't ever get glaucoma. That just means that at this time, some people can withstand elevated pressures, but over time may eventually lead to glaucoma. And that's why it's very important that if you've ever been told that you have a high pressures, that you do regular follow-up and you do get your checkups, and it's important to take your medications if ever anyone tells you to. So on the flip side of that, can I get glaucoma with low or normal pressures? And the answer is yes. There's a subset of this population that lives at pressures that are considered within the normal range for you and I, but their optic nerves just can't withstand that pressure. And we'll kind of come back to it. And these patients are called our normal tension or low tension glaucoma. And briefly, I just kind of want to go through with you the different types of glaucoma. In primary open-angle glaucoma, this is one of the most common forms of it, okay? And what happens in this case is that when I say open-angle glaucoma, remember when we were talking about the front structure of the eye, where the cornea meets the iris, right? And that at that angle was where our drainage pipe is. The open-angle portion of that means that the fluid that's made in the eye has access to that angle, and it's wide open, and that means it has access to our drainage pipes. It's not blocked for any other reason. And for whatever reason, in primary open-angle glaucoma, that drainage pipe just doesn't work as well as it should. And when that doesn't work as well as it should, that means that pressure slowly rises because the faucet is turned on, but the drainage pipe doesn't work as well. So more fluid is being made than it's actually being drained. And so if pressure slowly rises, you get optic nerve damage, and eventually you go blind. This is a chronic disease that's lifelong, and eventually and slowly can be progressive. But we have great medications that some of my colleagues are going to talk to you about today that can try to prevent or stall glaucoma. So the secondary forms of glaucoma means that there's something else, some other medical issue that's causing glaucoma, okay? Primary open-angle glaucoma has something to do with the drainage pipes. The secondary form of it has something to do with another portion of your medical condition that can cause it. For instance, somebody with diabetes that's uncontrolled can get something called neovascular glaucoma caused by these blood vessels that grow into the angle structures of the eye. Another cause could be somebody that has a very mature cataract, and I'm saying very, very mature, something that somebody can't potentially see because it's so advanced. And some of the portions of that cataract actually get released into that drainage pipe, and they clog the drainage pipe. The difference between some of these secondary glaucomas and our primary open-angle glaucoma is primary open-angle glaucoma, there's no cure yet for it. We have ongoing research, but there's no cure. But in secondary open-angle glaucomas, such as the mature cataract, you can potentially cure the glaucoma by actually removing the cataract from the eye like you would do a normal cataract surgery. And taking away that, that portion of the medical condition that's causing the glaucoma may actually cure you. Now, normal tension glaucoma is one of our more difficult ones to treat. And this is where the glaucoma occurs in patients that have that normal intraocular pressure, the pressure that sits inside the eye that's maybe normal for you and I, but somebody can't necessarily tolerate that. And what they've done is they've done studies that actually have shown that if you treat these people with pressure-lowering medications, most of them will actually not improve, but you can slow their progression rate. But there is a small subset that actually still continue to progress, which made us think, well, what are the other causes of glaucoma? And in these patients, they found a higher prevalence of what we call vasospastic disorders, meaning that spasms of your small blood vessels, such as migraine or Raynaud's, where you get your fingertips get numb and cold. And that really means that the small blood vessels in your body, including in the eye, can not have as much blood flow as we would want. And so something similar to a episodic hypotension, where the blood pressure is low, that means that the blood is not really flowing to the optic nerve the way that we want it to. and as much as it needs to be nourished. And so you can potentially get damage to the optic nerve because of these things. And so these are the things that are being now in the process of being researched, and hopefully over the future that we can find one of the causes and potentially a cure by treating some of these other conditions. Now, angle closure glaucoma is something you may have all heard of. Now, this is an ophthalmic emergency. And in this situation, we go back to our picture of where the cornea meets the iris. And remember, in a primary open-angle glaucoma is when I told you that you have the fluid has access to the drainage pipes, but the drainage pipes don't work well. Well, in angle closure glaucoma, we usually typically see is the peripheral part of the iris, the color part of your eye, bunches up, and it physically closes the angle of the eye, where fluid can get up into the anterior portion, but it can't get to your drainage pipes because they're physically blocked from it. And so in this case, remember I told you, in most cases of glaucoma, there are no symptoms. Well, in this case, it's different. Because the pressure rises so rapidly, because it's blocked, there's nowhere for it to go, so it rises very rapidly, because that faucet's on, but it has nowhere to go. It's not even draining little by little. It's not draining at all. So the pressure rises so rapidly that patients begin to notice this. And what happens is they start to get, they get symptoms of eye pain and brow pain, and they get blurred vision, and they get halos when they look around in the lights. And these are the symptoms that we see typically in patients that have this angle closure glaucoma. It's an ophthalmic emergency, and it needs to be seen immediately, because without treatment, it could cause blindness very quickly. And if anyone ever tells you that you have narrow, so this is something that comes along when patients call us and they say, am I allowed to take this medication? My family doctor gave me this medication, am I allowed to take it? And the reason that we get nervous is for patients that are more prone to getting this angle closure. Typically with patients that have the primary open-angle glaucoma, we're not as concerned. But if you've ever been told that you have a narrow angle, these are the patients that are at more risk for getting this angle closure glaucoma. And these are the patients that we like to tell, we usually tell, well, if there's a warning on the medication, then I would have you avoid it, okay? And lastly, unfortunately, there's something called congenital glaucoma. And this is a glaucoma that occurs at birth, typically, or within the first few years of life. And these patients have the open angle, but they don't have, their development doesn't allow them to develop that spongy-like material, the drain, the trabecular meshwork. And so it doesn't function. So the fluid can get there, but it just doesn't function. And they usually present with symptoms, and it can result in blindness. And these children, unfortunately, are very irritable, and they have light sensitivity and tearing, and they close their eyes during examination, and they have these cloudy corneas that we can see. And typically, these kids need a very good eye exam at birth, but if they get seen soon enough, they can be treated, and a lot of them have functional vision eventually for the rest of their lives, but they need to be seen for the rest of their lives. So that was just a little portion of glaucoma and what it exactly is. I hope you learned a little bit of something, and I hope you have a great day learning. Thank you very much.